stop! Before Mama Adaeze drinks that grapefruit juice this morning, there is something very important happening inside her body that nobody ever told her about. Mama Adaeze is a 60-year-old Nigerian woman. Every morning she wakes up, takes her heart medication, and enjoys a fresh grapefruit for breakfast. Her doctor told her to eat more fruit, so she is doing exactly that. But lately, her blood pressure is dangerously low. She feels dizzy, her heart is racing, and nobody can figure out why. The answer is sitting right there on her breakfast table. To understand what is happening, we need to travel inside Mama Adaeze's body, all the way down into her small intestine, where everything she swallows gets absorbed into her bloodstream. Think of the small intestine like a busy Lagos market. Thousands of tiny structures called villi line the walls, and their job is to grab everything that passes through, nutrients, water, and medication, and send it straight into the bloodstream. Normally, Mama Adaeze's heart medication enters this market street, gets absorbed smoothly, enters the bloodstream, and travels straight to the liver. And inside the liver, something very important is waiting. Meet CYP3A4. This is one of the most important enzymes in the entire human body. Think of it like the chief processing officer sitting inside the liver, and his one job is to break down every medication that arrives into safe, precise levels. Not too much, not too little. CYP3A4 is the reason medication dosages work correctly inside your body. Every tablet Mama Adaeze swallows arrives at CYP3A4, gets processed perfectly, and her body receives exactly the dose her doctor prescribed. But then the grapefruit arrives. Inside every grapefruit are special chemicals called furanocoumarins. These are not dangerous on their own, but when they reach the liver, they do something that changes everything. The furanocoumarins attach themselves directly onto the CYP3A4 enzyme and lock it down completely. The enzyme cannot move, cannot process, cannot work. And this shutdown does not last for 1 hour, or even a few hours. It lasts for up to 72 hours. Now here is where it becomes a serious medical problem. With CYP3A4 completely blocked, Mama Adaeze's heart medication keeps arriving in the bloodstream, but nothing is breaking it down anymore. It builds up and builds up. The medication level in her blood reaches 2 times the normal amount, then 3 times, then 4 times. She is effectively overdosing, without taking a single extra tablet. This is why she feels dizzy. This is why her heart is racing. This is why her blood pressure crashed dangerously low. The medication became toxic inside her body, and the only thing that changed was 1 glass of grapefruit juice at breakfast. Here is the most shocking part. Because the enzyme shutdown lasts 72 hours, even if Mama Adaeze drinks grapefruit juice on Monday morning and takes her medication on Wednesday, her CYP3A4 enzyme is still blocked. The grapefruit is still affecting her medication 3 days later. Now, grapefruit is not the only fruit that does this. Seville oranges, tangelos, and pomelos all contain the same furanocoumarins and cause the same dangerous interaction. Regular oranges, lemons, and limes are completely safe. Always know the difference. The medications most affected by grapefruit include amlodipine, simvastatin, atorvastatin, felodipine, and cyclosporin, and over 85 other drugs. If you or anyone you love takes heart medication, blood pressure medication, or cholesterol medication, this interaction is real, and it is dangerous. So what should Mama Adaeze do? Rule number 1. If you are on any of these medications, the safest approach is to avoid grapefruit and these related fruits completely. Because with 72 hours of enzyme disruption, there is no safe timing window. Rule number 2. Tell your doctor everything you eat and drink regularly. Grapefruit, herbal teas, neighborhood remedies, bitter leaf, moringa, all of it. This information directly affects how your medication works inside your body. Your doctor needs to know. Rule number 3. Never assume that natural means safe alongside medication. Grapefruit is natural. It is healthy. but it is also biochemically powerful enough to make prescription medication toxic. Food has pharmacological power. Always treat it that way. Mama Adaeze stopped the grapefruit, switched to bananas and regular oranges. Within 2 weeks, her blood pressure was perfect. Same medication, same dose, one single dietary change, and everything improved. And grapefruit is just one of hundreds of dangerous food and drug interactions that are quietly affecting people every single day. Tea destroying iron absorption, okra blocking metformin, milk disabling antibiotics, bitter leaf interfering with diabetes medication. This channel exists to teach you the biochemistry that keeps you. Because this is the science your doctor knows, and now you know it too. If this video helped you, share it immediately with anyone you know taking heart or blood pressure medication. Subscribe for new drug food science every single week. And watch our next video, where we show exactly how your morning tea is silently blocking your iron tablets from working. Stay curious, stay informed, and stay safe.